Hello and welcome to the first in a series of conversations surrounding the impact COVID-19 has had on the cancer pathway within the NHS. At Olympus, we feel this is an extremely important topic that we're keen to focus on over the coming weeks and months. COVID is still with us and still an enormous challenge for society and for our health and care system. The purpose of this series is to provide some general advice and insight on what to expect as a patient when returning to hospital. We do understand the fears of returning to hospital and the decisions of those that are choosing to stay away. But we hope that these conversations will provide some much needed support and insight in ways in which individual hospitals have adapted to these challenges. We understand that this conversation is an important one and constantly evolving and changing. Therefore, we must highlight that these conversations are based on now and in the individual's hospital, which is why, as advice changes, we'll keep the conversation going. Today, we have a urology focus and are delighted to be joined by Mr Ben Ayres, consultant urologist, clinical lead and clinical director of undergraduate surgical training at St George's University Hospital NHS Trust in London. Ben's kindly agreed to discuss with us some of the changes within his own hospital and the importance of patients returning for cancer diagnosis and treatment as quickly as possible. Thanks once again for joining us, Ben, and for agreeing to take part to talk about such an important topic. So Ben, firstly, please can you tell us about how the cancer diagnosis pathway has been affected in light of COVID-19?
Well, first of all, thank you for inviting me to take part in this event. As you've said, it's extremely important that we try and connect with our patients who have been affected by COVID-19 and whose pathways have been affected by COVID-19. So thank you for giving me this opportunity to let you know what we're doing. What we have found during COVID is that patients have been frightened about attending hospital appointments, and we have worked very hard to try and work with them to reduce the risk as much as we can to potentially coming into contact with COVID-19 whilst in the hospital. We can never say that there is no risk, but we have taken many steps to reduce that risk. We have continued to see patients and to diagnose cancer throughout the COVID-19 crisis. And it's important that we do that because we do not wish for our cancer patients to have delayed diagnosis or to have delayed treatment due to other issues going on within the hospital. Some of the steps we have taken are to try and do as much of our consultations as virtual as possible. So this may mean telephone calls, telephone consultations, and using web-based video platforms. This is a big change to how we would normally do things. And I know a lot of patients would prefer to come and see us and discuss things face to face. But really, if we can reduce patients traveling in and out of hospital and traveling into hospital, that does reduce the risk. So whilst we know that patients like talking to us face to face, and we will try and do that via web-based video if possible, telephone consultations we've found have been very fulfilling, very useful, and enabled us to explain to patients what's going on and to talk them through their symptoms and how we might manage them. Other steps that we have taken to reduce the risk is that we have different pathways within the hospital based on what's happening and what procedure you might be having and potential risk to COVID. So patients are all screened before they enter the hospital, and if they have any symptoms suggestive of COVID or have high temperature, then they are tested for COVID and go down a COVID pathway. If patients are not showing signs or symptoms, then they will be given advice on potentially isolating for a period of time before coming into the hospital. For surgery, we are asking patients and their whole household to isolate at home for 14 days prior to surgery, so that if anybody in that household does have COVID, the symptoms should have developed by then. We're also testing patients for COVID with a swab 48 to 72 hours before any surgical procedure. If all these criteria are fulfilled, then we can admit them to a special ward within the hospital and use special dedicated theatre space within the hospital where patients are going through similar pre-operative workup as themselves, i.e. the shielding at home, the isolating at home, and the tests at home, to mean that they're in as lower risk area as possible. As I said, we cannot make it completely risk-free, but it's as low risk as possible.
As we know, many patients concerned, obviously, as you've said, specifically in terms of specific departments. Can you kind of go through some of the changes there within maybe distancing measures, things like that, that you could let us know about?
Yes, so for example, with outpatient clinics, as we've been saying, we are trying to do as much virtually, be that by telephone or using web-based video platforms as much as possible. But there are times where we do need to see the patient and examine them. So we have taken a lot of measures to try and reduce the risk in that situation. The patients, the clinics are significantly have significantly fewer patients within them because of the steps we've taken to contact many patients virtually. So we don't have busy waiting rooms as patients may have experienced in the past. The busy waiting rooms have gone. Social distancing is a key aspect within the waiting room and within the department when you're there. All patients will be wearing a face covering, and all clinical and non-clinical staff will be wearing a mask to reduce the risks. We are getting patients into the clinic room as soon as we can, again to reduce the time they're waiting in the waiting room, and we've worked very hard with our clinic templates and sort of timings of patients to allow that to happen. What that does mean is that we are running slightly fewer appointments at each time, but that is important to really enable us to stick to the social distancing instructions and keep our patients as safe as we can.
Thank you very much. So obviously you've mentioned quite a few of the changes that have been made there to obviously to the pathway and to measures that have been put in place. We see a lot in the news about PPE and the changes that people can expect when they go into hospital. Obviously changes in supermarkets, things like that, with people wearing masks. Can you kind of describe to us on a day-to-day basis what sort of level of PPE and things like that you would be wearing on a day-to-day basis that could help protect you and the patient, or in surgery, for example?
So every doctor, every clinical staff, doctor, nurse, and other clinical or non-clinical staff within the hospital wear a face mask throughout the day in the hospital. We ask patients to wear a face covering or a face mask on entering the hospital, and as I've already said, we ask some questions about whether they have any symptoms that might be suggestive of COVID, and we check their temperature before allowing them into the hospital. If there are any signs or suggestions of COVID, then they would go down a COVID pathway. So whilst a patient might attend for an outpatient appointment, if it is one that needs to be done face-to-face, or for an investigation such as a scan or a flexible cystoscopy, then they will see every member of staff wearing a mask. When we approach the patient to examine them or to do a procedure, we will have gloves on, we will have aprons on, and we will also often have a face visor on as well as the mask. So there is doctors and nurses will look different to patients when they come into hospital, but all this equipment is in place for the patient's safety and to try and reduce the risk of COVID-19 as much as we possibly can.
Thank you. as obviously you've mentioned, early diagnosis is obviously extremely important. And as you said, you've been working throughout this, treating and diagnosing people. Please, can you explain some of the key symptoms that people would need to look out for in terms of urology cancers, or specifically for bladder cancer?
So one of the big symptoms that we ask patients to look out for is blood in their urine. There have been national campaigns about blood in the urine over the last few years, and this remains very important and very true today. If you are to see blood in your urine, you must contact your GP straight away. They will then talk you through, ask you some questions, other questions about your symptoms, but they will then be able to refer you on to a specialist within the hospital. So blood in the urine is a very important symptom and sign to look out for. Now, not everybody who has blood in their urine has a urological cancer. The numbers that ultimately end up having a urological cancer are small. So I don't want to unnecessarily frighten people, but it is extremely important that those symptoms are investigated, because a significant proportion will have an underlying cancer that can be picked up and treated. So please, please, please contact your doctor straight away if you ever see blood in your urine, whether that's during COVID time or non-COVID times. Other urological symptoms or symptoms that might point towards a urological cancer and things that you should look out for are if you feel a lump on your testicles. So we do encourage men to examine their testicles once a month, and should they notice any lumps or any changes to their testicles, again, they should talk to their GP and get referred in. Another area of cancer that is often goes unknown and is unknown a lot amongst a lot of the general public is penile cancer. So men can get cancer on the penis. So if they develop an ulcer, a persistent red patch, a lump on the penis, or any discharge from the penis, then again, it's really important you see your doctor or talk to your doctor. You may not be able to see them directly because of COVID, but get an appointment and talk to your doctor straight away for referral to hospital. Some men, a lot of men experience a change in their urinary flow and go to the toilet more often and potentially get up at night as they get older. And these symptoms can affect female patients as well. The vast majority of times, change in urinary symptoms are not cancer related, but occasionally they can be. So again, if you've noticed any change in your urinary symptoms, please speak to a doctor and take their advice, and they will refer you into the hospital, do some tests to start off with as required. There are also some general signs and symptoms of patients who might have cancer, such as weight loss, unexpected weight loss, unintentional weight loss, and feeling really tired and lethargic all of the time. Again, there are other causes for this, so I don't want to cause alarm, but if you have experienced unintentional weight loss or are suffering with lethargy, again, please discuss that urgently with your GP, and they can make the appropriate onward necessary referrals.
I mean, as you've said, it's extremely important that people get checked. I mean, how important is it that people get checked as quickly as possible, even if they think the symptoms are minor, as you say, in COVID time or any other time?
The sooner that we run tests for these symptoms, and if there is an underlying cancer, if we pick it up early, there is a lot more that we can offer in terms of curative treatment than if we pick up a cancer late. That's not to say late cancers cannot be treated. Of course they can, and we're having lots and lots of success. But if we can pick up a cancer in the earlier stages of its development, we have a lot more treatments available to us. And actually, some of the treatments may have less side effects for the patient as a result, or cause less change to their lifestyles. So the sooner we diagnose cancer, if it is there, the better in terms of getting the best possible treatment for our patients. So yes, please, if you have these symptoms, as I've said, a lot of the time these symptoms are not necessarily due to cancer, but it's important that you let the doctor know, so that it's the doctor can do the necessary tests and the necessary referrals to really understand what's going on. And then if there is a cancer, picking it up early is very, very important. So please do not ignore these symptoms. I appreciate COVID is causing a lot of fear, completely understandably causing a lot of fear in people. And a lot of people have been doing what we've been asking them, which has been to stay at home. That has really helped with the initial management of COVID. But if you have these symptoms, it is really important that you get checked out. If you have fears about coming into hospital, still, please let your GP know. Please then let the hospital know, because consultants such as myself can contact you. We can have that first consultation virtually over the phone in the comfort of your own home and talk you through what steps we can take to try and investigate your symptoms, but also, as I've said, to reduce the risk to you of COVID. So please don't let COVID stop you talking to your doctor or getting a referral in. Please do it. And we look at everybody on a case-by-case basis. We know everybody is unique, everybody is individual, everybody will have their own different concerns or different fears, and we will do our best to address those on an individual basis. So please do not let this moment go by. Do get in touch with us. Do contact us.
So there are obviously people who have already been diagnosed, who may have severe symptoms that require urgent treatment, but for example are self-isolating due to the risk of COVID-19.
So in that situation, please again contact your doctor, and your case will be assessed on an individual basis. So if your symptoms are new, please contact your GP to get referral into the hospital. If you already have been diagnosed and you're self-isolating because of your cancer diagnosis, then please contact your consultant, your consultant's team, your Macmillan nurse specialist, your key worker, all the people that you will have had contact with, and I would hope have contact details, both phone and email, to contact. Please contact us and we will get back in touch, as I say, in the first instance virtually, so that can be done in the comfort of your own home, and discuss your needs, your symptoms and plans on a case-by-case basis. Ultimately, after that discussion, it may be that we agree that you need to come into hospital for some treatment. As I've said, we have put a lot of measures in place to try and reduce the risk of COVID within the hospital to patients in that situation. We have wards where patients are only allowed on if they've isolated, their whole household is isolated for 14 days and they've tested negative for COVID before they come in. So clearly there are areas in the hospital that have been designed to be as low risk as possible, albeit nobody can say risk-free. We cannot completely remove the risk, but we are working very hard to significantly reduce that risk with measures such as I've said there, and doctors, nurses, clinical teams and patients all wearing masks, and the clinicians wearing full PPE when attending to patients. So please get in touch if you are isolating but you have worsening symptoms or concerns. Please get in touch and share those concerns with us, and we will try and work with you on a case-by-case basis.